As a state, we are here to do what we can to support you and to be there at a time of need. I've tasked the Surgeon General of the state of California, Dr. Nadine Harris-Burke, to put together a strategy and a protocol to help support you and to support caregivers that need the peer-to-peer support, a little psychological first aid themselves to get through the day and to continue to thrive, not just survive in terms of the workload as they're taking care of people. And there's nothing to be ashamed by recognizing your own limitations in terms of the stress and the angst that you may feel. And so we are putting out guidelines. We're putting out guidance not only to our health plans in the state of California, both on the private side and on the public side, our medical system, but we're also putting a playbook together for you, a checklist as adults, as caregivers, but also a checklist for our children, because everything I just said, it's translated very differently into our children. Our children aren't able to communicate words like this: boy, I'm completely stressed out. Not a young child, maybe a teenager, but not a young child. And they manifest stress very differently. They have a tummy ache. They may not be sleeping as well. They may be particularly irritable, sort of jumping back and forth. Well, I explained my daughter a few weeks ago as she threw her bed over because she was so upset when I told her it's likely she wasn't going to go back to school and see her friends this school year. Everybody manifests this differently, and our children are most vulnerable because they're not able to communicate as effectively as many of the adults and caregivers. So we have a playbook for them as well. We have on our covid19.ca.gov website, covid19.ca.gov website, we have 16 hotlines that we have made available, including text chat lines where people can address their particular needs as it relates to domestic violence, intimate partner battering. We're seeing increasing in times of stress and the need to get help. You can call that DV hotline. Elder abuse. We obviously have to take care of our seniors. We have a hotline for that. Child abuse. We have a hotline for that. Teens feeling deep emotional stress that are feeling in crisis. We have a teen crisis hotline. All of these things available in many, many languages, up to 170 languages in some instances. LGBTQ and their unique challenges. Across the spectrum, supports, substance abuse, alcohol abuse, all of those hotlines, all of those resource sites are available on covid19.ca.gov to help support you during these times of needs. Stress hormones create the kind of anxiety that induces other secondary effects. It impacts your blood pressure. It impacts your heart and can increase the likelihood of a stroke. It can impact your diabetes. It can certainly impact your sense of well-being and depression and the like. And so the secondary health impacts are a big part of what we're also looking to respond to. And that's, again, the purpose of the guidance we're putting out today and the incredible work that our Surgeon General has been doing.
The actions we're all taking to slow the spread of coronavirus, physical distancing, hand washing, wearing masks, and proper disinfecting, are critically necessary and remain the top priority. But while we keep our physical distance, our social supports to maintain emotional and spiritual connection are more important than ever for our physical and mental health. The health impacts of coronavirus go beyond infection and COVID disease. It is important to recognize that stress related to the pandemic that many are feeling right now, compounded by the economic distress due to lost wages, employment, and financial assets, plus school closures and sustained physical distancing, can trigger the biological stress response, which also has an impact on our health and well-being. During times of heightened stress, our bodies make more stress hormones, including adrenaline and cortisol, and these can affect our health, our behaviors, and our emotions. It's important to know that these changes aren't just in your head, and to begin to identify how stress shows up for you, physically, emotionally, and behaviorally. Individuals who have a history of trauma or adversity may also be at greater risk. The good news is that there are simple ways, simple things that you can do every day at home to protect your and your family's health. Safe, stable, and nurturing relationships help to protect our brains and bodies from the harmful effects of stress and adversity. Healthy nutrition, regular exercise, mindfulness like meditation, good sleep hygiene, and staying connected to our social supports and getting mental health care all help to decrease stress hormones and improve our health. We've brought together evidence-based guidance in the Surgeon General's playbook on stress relief during COVID-19 and an additional playbook for caregivers and kids that offers practical tools and tips that you can add to your daily routine. If you are concerned about the effects of stress on your health, call your doctor or your mental health professional. And if you need help finding resources, visit the Emotional Support and Wellbeing homepage at covid19.ca.gov. Thank you.